Oh my God, alcohol. Especially drinking alcohol in excess can result to alcoholic liver disease. When you drink too much alcohol, it's metabolized in the liver, leading to the accumulation of fats. This initial stage often shows as a fatty liver, but can be reversible if you put a stop to drinking alcohol. Too much alcohol intake can also cause inflammation to the liver, leading to alcoholic hepatitis. Several symptoms can emerge from mild to severe and may include jaundice, abdominal pain, and liver enlargement. But if alcoholic hepatitis is left unchecked, it can result in the development of scar tissue in the liver known as fibrosis. At this stage, the liver tries to repair itself from the sustained damage, but scarring begins to interfere with its function. Continued and severe liver damage can also lead to cirrhosis, where extensive scarring replaces healthy liver tissue. Cirrhosis is irreversible and can lead to liver failure, increased risk of liver cancer, and various complications affecting other organs in the body. Just try to reduce or stop alcohol consumption, especially in the early stages. It can help prevent further liver damage and even reverse early signs of liver disease. Yes, paracetamol is generally safe within recommended doses, but excessive or prolonged use can lead to liver damage or even liver failure. This risk increases significantly when taken in higher doses than recommended or in combination with alcohol. Some antibiotics, especially those in the class of macrolides or tetracyclines, may cause liver damage in rare cases. Monitoring liver function while on these medications is very important, especially if you have pre-existing liver conditions. Also, some prescription pills, including those used to treat conditions like high blood pressure, cancer, and heart disease, might have adverse effects on the liver in some people. These effects can be mild elevations in liver enzymes to more severe liver injury. Not just that, some herbal supplements and over-the-counter pills may have components that can harm liver, especially when taken in high doses or for a long period of time. Please, you have to make sure you only take your medications as prescribed and directed by your healthcare provider. You should also inform your doctor about any pre-existing liver conditions or other medications and supplements you are taking to minimize the risk of liver damage. Excess body weight and obesity can contribute to the development of fatty liver disease and liver damage. Obesity often leads to insulin resistance, where the body cell become less responsive to insulin. This metabolic disturbance can contribute to fat accumulation in the liver. Also, when there is excessive body weight, it can lead to an increased fat storage, not only in adipose tissue, but also in the liver, leading to NAFLD, non-alcoholic fatty liver disease. This condition can progress from simple fatty liver to more severe stages involving inflammation known as NASH, non-alcoholic steatohepatitis, fibrosis, cirrhosis, and an increased risk of liver cancer. Obesity is also accompanied by other metabolic conditions like type 2 diabetes, high blood pressure, and abnormal levels of lipids in the blood, which can further contribute to liver damage. Managing obesity through lifestyle modifications like eating a balanced diet, exercising regularly, and losing weight can really reduce the risk and progression of NAFLD. If you've gotten to this stage and you've not subscribed, please do make sure you give this video a massive thumbs up so that the algorithm can push this video to other people that can benefit from this. Also turn on the post notification bell so that you can be notified once I upload new videos. Thank you. Viral hepatitis like hepatitis B and C can cause inflammation and damage to the liver. Hepatitis B virus spreads through contact with infected blood, bodily fluids, or from mother to child during childbirth. It can cause both acute and chronic infections. Chronic hepatitis B infections can lead to liver inflammation, increasing the risk of cirrhosis and liver cancer over time. Hepatitis C virus is usually transmitted through blood-to-blood contact and can also lead to chronic infection. And without proper treatment, it can cause inflammation in the liver and lead to cirrhosis or risk of liver cancer, just like the dangers of hepatitis B. The most scary thing about these viruses is that they can be asymptomatic for many years, causing damage to the liver without noticeable symptoms, which can make early detection and treatment challenging. The good news is that there are vaccines available for hepatitis B, which can prevent infection. It is also important to note of regular screenings and practicing safe behaviors like using sterile needles and practicing safe sex to prevent viral infections. Certain chemicals used in industries like pesticides, herbicides, solvents, and heavy metals like lead, mercury, and arsenic can have hepatotoxic effects if exposure occurs at high levels or over prolonged periods, can eventually harm the liver. Not just that, pollutants in air, water, and soil, including dioxins, polychlorinated biphenyls, and some toxic metals, might contribute to liver damage when exposed for too long. Harmful algal blooms in water bodies can produce toxins, and when they get ingested, it may affect the liver and other organs. Apart from the well-known effect of alcohol on the liver, smoking can indirectly affect liver health by increasing the production of harmful free radicals that can damage liver cells. By reducing exposure to these toxins and chemicals, by following safety protocols in industrial settings, ensuring proper ventilation when handling chemicals, drinking clean and safe water can reduce the risk of liver disease. Autoimmune hepatitis is one of the autoimmune conditions that specifically targets the liver. In autoimmune hepatitis, the body's immune system mistakenly identifies liver cells as foreign and attacks them, leading to inflammation and damage within the liver. This condition can range from mild to severe and might progress to cirrhosis or liver failure if left untreated. It's not entirely clear what triggers autoimmune hepatitis, but genetic, environmental, and immunological factors likely play a role. Symptoms of autoimmune hepatitis may include fatigue, abdominal discomfort, jaundice, joint pain, and in more severe cases, complications related to advanced liver damage. Treatment usually involves medications to suppress the immune system's activity to reduce inflammation in the liver. Corticosteroids and other immunosuppressive medications are commonly used to manage autoimmune hepatitis. Regular monitoring and follow-ups is also very important to manage the condition to prevent complications. Apart from hepatitis viruses, there are other viruses like cytomegalovirus or Epstein-Barr virus that can cause liver inflammation and damage. Cytomegalovirus, also known as CMV, is a common virus that can cause liver inflammation in people with weakened immune systems, like people with HIV and AIDS or organ transplant patients. For people that are healthy, CMV infections don't cause significant liver issues. Epstein-Barr virus, also known as EBV, can also lead to hepatitis in some cases. Liver involvement in EBV-related mono is usually mild and resolves on its own, but in rare cases, it can lead to more severe liver problems. Various other viruses like adenoviruses and certain herpes viruses can cause liver inflammation and affect liver function, especially in people with compromised immune systems.